TV. We are here today with Dr. Michael Wald, Doctor of Nutrition and Director of Nutritional Services at Integrated Medicine of Mount Kisco, PC. Our topic today is natural hormones. What is the definition of a natural hormone and where does it come from?
Well, in a couple of minutes, I'm going to give you the most concise definition of natural hormones because this is such an important topic and there's a lot of misinformation out there. First of all, there are no hormones in plant foods. So you'll hear a lot of nutritionally minded people and actual licensed nutritionists saying, there are bioidentical hormones or natural hormones in plants. There are not. There are chemicals that look very similar to hormones and in a laboratory can easily be converted to hormones and may actually act as hormones in the body, but they're not hormones. So natural hormones by definition are really hormones that are synthetic. They're made in a laboratory, but they could be made from natural foods like wild yams or soy products. So that is the definition of a natural hormone.
What are the most common uses for natural hormones?
Well, there are lots of different uses for natural hormones in the body. For example, natural hormones found in soy are known to reduce cardiovascular disease because soy products and natural hormones in soy can mimic estrogens, and lower estrogens, particularly in women, are associated with increased cardiovascular risk. There are natural hormones in certain foods that resemble testosterone, which might help virility or sex drive or libido or sexual responsiveness. Hormones in plants or bioidentical hormones can be used for perimenopausal symptoms, postmenopausal symptoms, and to improve just general health and well-being. Lots and lots of different symptoms and health problems that can be treated by the use of natural hormones.
What is a bioidentical hormone?
So as I've alluded to, a bioidentical hormone is a hormone that looks and must look exactly like hormones made in the body. So, for example, drug and pharmaceutical manufacturers or nutrient manufacturers could take soy products or wild yam components and in the laboratory convert them or turn them in to actual hormones that look exactly molecule for molecule like those produced in either a man or a woman's body. So a bioidentical hormone is bioidentical. As the name implies, it is exactly identical to the hormones made in the body. And a bioidentical hormone, by being virtually identical, has friendly physiologic effects in the body as opposed to unnatural hormones, which are really the traditional hormone replacement type therapies or birth control pills used by traditionally trained physicians.
What are some of the benefits as well as some of the risks associated with the use of bioidentical hormones?
Well, first of all, there are risks associated with bioidentical hormones. They are hormones, and they are prescription. So, although they're much weaker than the traditional hormone replacement therapy given by OBs and, let's say, endocrinologists or by some internists and family practitioners, they are hormones. So a person could overdose on hormones and they could underdose on hormones. But overdosing is the key issue. There are many symptoms that can indicate that someone's overdosing of hormones. So, but on the other hand, the benefits of bioidentical or natural hormones, in my opinion, and based on the research, far outweigh the possibilities of negative symptoms, particularly when the bioidentical hormones are recommended by someone who knows what they're doing. So the benefits of bioidentical hormones include everything from increasing one's general sense of well-being. They just tend to improve energy, healing, and general appearance. Bioidentical hormones can be used to enhance exercise performance, to improve memory, to improve immunity, and to reduce lots of the effects of aging, such as slowing down the formation of wrinkles and helping tissues repair better. Think of it this way. As we age as human beings, we have a reduction of hormones. In fact, the hormone decline theory of aging is the number one theory as to why human beings age and get disease. So as a person grows older and older and the hormone levels decline, the rate of disease and disability always goes up. So therefore, the right bioidentical hormones are longevity promoting by helping to reduce one's risk of developing these diseases that were once thought to be diseases of aging, but they're really not. They're diseases of unnatural aging because our hormones are declining far sooner and far more dramatically than they naturally should be.
This has been Dr. Michael Wald.